Most people with diabetes are told to watch their A1c. But did you know that hemoglobin A1c sometimes lie? What if your real blood sugar story was hidden in another test called fructosamine? Today we will break down both tests, how they work, when each of them matters. Welcome back to Kundlas MD. I am Dr. Kundlas and my goal is to make diabetes care simple and clear. By the end of this video, you will understand what hemoglobin A1c measure, what fructosamine adds to the picture, and how these tests guide your health. A1c is a short for hemoglobin A1c. It measures how your sugars stick to your red blood cells. Red blood cells live about 3 months, so A1c shows your average blood sugar over a period of the last 3 months. Think of it as your report card for this semester. Normal is under 5.7, pre-diabetes run from 5.7 to 6.4, and diabetes is more than 6.5. The adults, all diabetics, should aim to stay under 7 to prevent body damage. Higher your A1c, higher your risk of developing problems. We are talking about eye disease, kidney disease, nerve pain, heart troubles. Every 1% drop in the A1c cuts the complications by 30%. So even small changes matter. But here is the problem. Hemoglobin A1c is not always accurate. Anemia, transfusion, sickle cell trait, kidney disease, pregnancy, iron deficiency anemia can make this number misleading because it affects your hemoglobin in the blood cells. Sometimes your daily blood sugar don't match with your A1c at all. That is where fructosamine comes in. Fructosamine measures sugar stuck to the protein in the blood, mainly albumin. Protein in your system for only about 2 to 3 weeks. So fructosamine shows your average blood sugar for last couple of weeks. If your A1c is your semester report card, fructosamine is your pop quiz every 2 weeks. This test is great when we need short-term picture. For example, pregnancy, patients with sickle cell disease, patient who just had transfusion, or when you change therapy and you want quick feedback. It is also useful when A1c feels off as compared to your blood sugar logs. No test is perfect. Fructose depends on protein level. So if your protein level is low in liver disease, kidney disease, malnutrition, these results may be falsely low. High vitamin C, thyroid diseases, and lab interference can also affect fructose. That is why we always interpret in context. No test is perfect without context, and if one test doesn't make any sense, we combine them. Let's put them side by side. Hemoglobin A1c is your 3-month semester report card. That is a gold standard. Fructosamine gives you 2 to 3 weeks short-term view, but very useful. It can guide you which way you are going. If your 2 to 3 week tests are going wrong, you know that your A1c will be high. Use hemoglobin A1c and fructosamine as partners to get the full picture together. So here is the bottom line. A1c tells you long-term story, fill in the gaps when A1c can't be trusted. Both matter. Both can guide you for better control and fewer complications. If you think this video was helpful, like, share and subscribe to our channel Kundlas MD, and I will see you in one of our next videos. Thank you.